We are here today to send a clear message to Gillian Skinner that New South Wales will not accept a reduction in the quality and staffing of our aged care sector.
I'm not very happy with what Minister Skinner has done, removing this legislative requirement that registered nurses must be on duty 24 hours a day, 7 days a week in aged care facilities.
Why? Registered nurses are crucial to the delivery of safe quality care to our elderly in nursing homes. We assess, we plan, we implement the nursing care delivered to our residents.
This decision goes against the recommendations from last year's inquiry into the registered nurses in New South Wales nursing home, which received unanimous cross-party support. And in true dictatorial style, they've just marched on and said, no, we're not having that. It's now a Commonwealth issue.
Many more RNs are required to adequately deliver care.
And to add insult to injury, the federal government's recent budget aims to cut another $1.2 billion out of funding for nursing home residents with complex care needs over the next 4 years. The budget papers said that the reason they have to cut that amount out of the healthcare is to stabilise higher than expected growth. The logic is just inconceivable.
The Minister, in fact, should be leading the charge, not behind. This question of registered nurses 24/7 is about to become a federal election issue.
Simple tasks that could be carried out by RNs in aged care facilities will now need to be referred to our emergency departments.
Our ambulance services and emergency departments are already stretched to the limit. 8 out of 10 call-outs last year were from nursing homes.
Residents will continue to pay exorbitant fees to gain a place in these facilities, yet they'll receive unacceptable levels of care from untrained staff who can't manage their complex issues. I don't think there's anybody that really is for this except Mrs Skinner and her government and the providers of these organisations.
The rostering of an RN now will be based on the discretion of the aged care facility provider, not based on the high care needs of residents.
We all know that amongst aged care providers there are the good, the bad and the ugly. It's therefore not good enough to leave it up to the industry to regulate itself. There needs to be greater accountability, not less. And until we can be assured that the federal government will act to ensure RNs are available 24/7, we must keep this requirement in New South Wales.
So I am urging her to please listen to us because there is too much at stake.
Let's tell Minister Skinner and the Baird government that we will not, and I say we will not, accept these changes because every Australian deserves the right to a little dignity in the final stages of their lives.